Sleep apnea. Imagine waking in the middle of the night and your spouse is not breathing, and in your panic, you shake them violently hoping to get a response. Much to your relief, you do get a response. Most people would shrug this off as just a minor incident and not bother with the time or expense of seeing a doctor. However, a visit to the doctor will prove otherwise. After you undergo a sleep test, you will be diagnosed with sleep apnea. It's a common sleep disorder that many people are affected by every night. It causes you to have pauses in breathing during your sleep. These pauses can range from a mere seconds to a few minutes. For most, they aren't even aware that they have stopped breathing. Usually, a loved one or a bed partner witnesses this occurrence and advises the person to go see a doctor. That's what happened to my dad. If it wasn't for my mom shaking him awake every night, he would not have known that he had the sleep disorder. Since I brought this disorder to your attention, I would like to explain what sleep apnea is. Sleep apnea is some common causes, some symptoms, and possible treatments. During sleep for normal people, the muscles around your throat relax, leading to a slight narrowing of slight narrowing of the throat, causing no problems whatsoever when breathing. However, people with sleep apnea, the narrowing in the throat becomes so severe that the airflow is blocked and you stop breathing. This right here is a diagram of the passage of air. Air goes through your nose and down your esophagus or through your mouth. The passage here with people who have sleep apnea closes so tightly that no air goes through. Sleep apnea occurs when the sleeping brain senses the person is having difficulty breathing and will awaken, and it will increase the effort the brain puts forth to help you breathe. Eventually, the brain's increased effort to breathe will awaken the brain or the person sleeping, causing the throat muscles to become active and decrease the sleeping person, causing the throat muscles to become active and reopening the breathing passage. This causes the effort to breathe to decrease, and the sleeping person then goes back to sleep. This cycle can continue throughout the entire night, with waking and going back to sleep constantly. These awakenings are so brief that the person who is sleeping is not even aware that they are occurring. Some common factors associated in people with sleep apnea are a tendency to be overweight. Usually they have larger tongues, smaller jaws, or enlarged tonsils. All of these can restrict your breathing passage. Some common symptoms of people of sleep apnea are excessively loud snoring, snoring interrupted by pauses or gasps, falling asleep at work or while driving. The person has difficulty concentrating, they become forgetful, they suffer from irritability, anxiety, depression. Sometimes they wake in the morning with a severe headache or nausea, frequent trips to the bathroom during the night, and a loss of interest in sex. When your sleep is disrupted, it can also lead to high blood pressure, heart failure, heart attack, stroke, or even death. All of these problems usually appear slowly over a period of several years, making the person unaware that they have any problem whatsoever. One of the first steps to determining if you have sleep apnea will be to undergo a sleep study test. What they do during a sleep study test is they take tiny sensors and position them at different parts of your body to record your brain waves, your muscle activities, your leg and arm movements, heart rhythms, and other body functions. You will have a wire probe or a small plastic prong attached to your nose and your mouth airways. And this is to measure your airflow rate coming in and out of your lungs. Elastic bands will also be placed around your chest and your abdomen to measure the effort made to breathe, and a device clipped to an earlobe or a fingertip to monitor your oxygen level. All this monitoring will help the doctors determine if you have sleep apnea or some other type of sleep disorder. In the sentences that follow, I will list various prevention methods you can take. You'll want to begin by avoiding factors that may prohibit your breathing during sleep, such as alcohol, sleeping pills, or other medications that may cause drowsiness. All of these should not be digested within 4 hours of sleep, as they may cause problems to develop. You should sleep lying on one side or on your stomach, because most people who sleep on their back do suffer from sleep apnea. It restricts the air passage more. Maintaining a healthy weight will also help people, since studies have shown individuals who are overweight have a smaller air passage because they have more fat around their throat. Some specific treatments for those diagnosed with sleep apnea are a PAP, which stands for Positive Airway Pressure Mask. It is a light mask. It's worn over the face, or it's worn over the nose and the mouth during your sleep. An air pump gently pumps light air pressure through your mouth, creating the muscles around your throat to stay open. This right here is a diagram of such said device. It would go over your head, and then this is where your mouth and your nose would be, and it just creates an airflow. That way, whenever your muscles start to constrict your air while snoring or such occurs, it allows your throat to stay open. And it will allow you to breathe normally throughout the night. These masks come in all sorts of different shapes and sizes to fit anyone's face, because everyone has a different size, shape, face. There are also different types of masks. Some fit over the nose, some fit over the mouth, some fit over the mouth and the nose. Some only change the pressure produced when breathing in and out, or when snoring and closing the throat occurs. So when that happens, it'll change the pressure that goes in and out. Different devices were created to improve comfort for the users, because let's face it, a big thing over your head is not going to help you sleep. Another treatment is to undergo surgery of physical problems that you may have, such as enlarged tonsils or tongue, nasal growths, or certain sizes or shapes of the face. If your jaw is too small, it may restrict your airflow. Surgery could also increase the size of your throat, allowing for more air to pass through. As with any surgery, complications could arise, and it's best to try any other alternatives before surgical means is necessary. Doctors usually recommend exercises and eating healthy as a start to treating this disorder and fitting the patient with a PAP mask. In conclusion, you've learned about what sleep apnea is and common symptoms. I have also informed you of some possible treatments. If sleep apnea goes untreated, heart attack, heart failure, stroke, or even death may occur.